Hi everyone, Jeremy here from Phoenix Regen. Now, I've got to tell you, over the last 2 weeks, I have completely changed the way that I look at shoulder injuries, and that is because I picked up a shoulder injury myself. Now, I was playing cricket 2 weeks ago, and I know what you're thinking, I'm too old and too slow, and that's exactly what happened. I tried to sprint and I tore my hamstring, and that's for another video. But what I did was, while running and trying to make up my ground, I dove and I actually landed on some concrete, and it actually put a lot of pressure through the front half of my shoulder here, okay? And now, why I didn't do a dislocation, I really irritated the capsule. And the capsule is what holds all that fluid inside your shoulder joint. And this is what typically gets inflamed when people have capsulitis or frozen shoulder. This wasn't a chronic thing for me. This was because of trauma. What happens is, when you have that joint and you irritate it, you stretch out the tissues at the front, they become irritated and you have extra tissue. Exactly how you can overstretch an ankle. That's exactly what I did to my shoulder. Now, I treat these types of things every single day in my clinic, every day. And I would like to say that I've fairly experienced with it because of that. But I have to say, I have changed my entire way that I treat patients with this. And that's because they are so painful. Typically, when a patient comes in with tendonitis or any type of inflammation inside the joint itself, what we want to tell patients is to relax. It will get better, okay? And we don't want to do any type of injections. We don't want to do anything other than just give the tissue time to heal and move it. That is very easy for a doctor to say, and as myself saying that to patients, but when you've got that pain, it is absolutely unbelievable. So, tendon pain, which I tend to tell patients, is worse when you're relaxing. Tendon pain tends to get worse when patients are resting, okay? So this is often pain in the shoulder that, while patients are up and moving and active, they can even forget they've got pain. But then at night, it really bites in. And look, I have patients all the time coming in saying, how painful is it at night? Can I get an injection? Can I get an injection? And they've been to the doctor, they've been to the physio, they've been to the chiropractor. Can you just give me an injection? Which I've always been very much like, okay, let's calm it down. But you know what? I completely understand these patients now. It doesn't matter. Like any inflammatories, painkillers, they work, but they definitely don't take away that pain. And it is a pain that you cannot find a good position to put your shoulder in. It's horrific. For all those shoulder pain sufferers out there with chronic tendonitis, or even if you've just done an injury yourself now, I understand your pain and I feel your pain. And it really has got me to change a lot of things that I will offer to patients, because as practitioners, what we want to do is we want to do the least amount as possible to help patients heal. We want their body to do it naturally, okay? The more intervention, often the times, the more problems that can arise. But after this episode, I can really see why patients really seek for help. And what I'm going to try and do is teach you guys over the next 3 videos what I've done for myself to try and make the progress go faster, okay? Now, from the outset, I want to tell you guys that this will get better just with time, okay? Most shoulder injuries that have happened acutely because of trauma will get better with time, okay? But in that meantime, the lack of sleep, the discomfort, everything like that, I really understand why patients want to do everything they can to try and shave days, months, weeks, whatever they can off that healing time to get themselves back to moving as fast as they can, okay? So that's going to be the next video. Look forward to seeing you then. What I'm going to explain to you in the next video is a little bit of the differential diagnosis. That means which tissues tend to be injured in which, and then how you can sort of differentiate them for yourself. And then also I'm going to explain what we've done biomechanically to try and help my shoulder get better. And then I'm also going to explain to you what the more invasive, a little bit more, I won't say over the top, but what I would offer to my mother if she had the same problems. So I look forward to talking to you about these. And in the meantime, guys, if you've got shoulder pain, you've got any problem yourself, please let us know what's happening. We'd love to see if we can help you, okay? Have a lovely day. Bye.